I'd like to call you up real quick to hear consideration of PCS for HB 349, sickle cell management and treatment education for physicians. You are recognized.
Thank you, Chair. Thank you for actually agendaing this bill, and thank you to our Vice Chair and our Ranking Member. PCS for HB 349, this bill provides for 2-hour sickle cell disease management and treatment course to be created, which will be included in the continuing education requirements for medical physicians as part of their licensure renewal. Sickle cell disease is an inherited blood disorder that affects red blood cells, causing serious health complications as a chronic pain, anemia, stroke, and more are sometimes the complications. Sickle cell disease is a condition that disproportionately affects individuals of African American or Afro-Caribbean descent. According to the CDC, approximately 1 out of every 13 Black Americans carries the sickle cell trait. Individuals with this disease are frequently labeled as drug seekers and are not prioritized or taken seriously when seeking health care in hospitals and emergency room departments to ease their pain. These patients are not only suffering from the pain caused by their condition, but also suffering from the discrimination and misconception surrounding it. This bill, which seeks to create a sickle cell management and treatment education course to be included in physicians' licensure renewal, will help increase physicians' awareness on these issues and help address the inconsistencies in treatments. And I hope that's the bill.
Fantastic. Members, having explained her bill, are there any questions on the bill? Any questions? Seeing no questions, we're in public testimony on the bill. We have Kimba Gosher, with President of Advancing Sickle Cell Advocacy Project, is appearing in person. You are recognized.
Good afternoon, and thank you to Madam Chair and all committee members for the opportunity to speak in support of PCS for HB 349. I'm the president of Advancing Sickle Cell Advocacy Project. I'm a certified sickle cell educator and counselor, but most importantly, I'm the mother of an adult living with sickle cell disease. I was told when my daughter was 2 years old, do not plan for college for her because she would not survive long enough to see college. And this was told to me by an emergency room physician. And I internalized this information to the point where we dreaded birthdays and felt as if it was getting closer every birthday to her not being here. My daughter is now 30 years old and has had over 50 hospitalizations. She's also suffered from several severe complications, landing her in the ICU, and she lives daily with chronic pain. One key aspect that this bill tackles is pain management, which is a critical and often overlooked component of sickle cell care. By acknowledging and addressing the unique pain points faced by individuals with sickle cell, this legislation takes a crucial step towards fostering a more compassionate and effective healthcare system. Regrettably, the knowledge of healthcare professionals in the U.S. regarding the care of individuals with sickle cell disease, as Representative Robinson stated, is notably lacking compared with other inherited conditions. Despite sickle cell disease being the most common inherited condition in the country, with Florida being in the top 2 states with the highest population of people living with sickle cell disease. So in closing, I urge you to support the passing of PCS for HB 349.
Thank you.
Thank you for your time and dedication and commitment to improving the well-being of our community members. Thank you.
Thank you for coming. Sabrina Carter, with member of ASAP. You're recognized.
Good afternoon to everyone. My name is Sabrina Carter, and all of...
Is your microphone on?
Yes. Good afternoon, everyone, and everyone in the committee. My name is Sabrina Carter. I am a mom of a sickle cell warrior. My daughter is 12 years old. Recently, which is as early as yesterday, she is in risk of losing her sight. We went to the ophthalmologist surgeon and was told, I am sorry. I wish that I knew more information about sickle cell. The truth is, I don't know how to treat her because I don't have enough information. That is hard as a parent to hear that information. I apologize for my emotions. I am speaking from my heart. And so I just want to encourage you for your support for this bill, HB 349, because it is very imperative that the physicians get the education so that they can help treat our kids. And it's not just our kids have friends, our kids have families. So it's not just a cultural thing. I ask that you unify and vote yes to this bill. Thank you so much for your time and your patience. Please have a great day. Thank you so much.
Thank you. Thank you for coming and testifying. Next up, we have Dr. Linda Hill, and I can't read the last name. Pendra? Purdue. Thank you. You are recognized.
All right, good morning to everyone in your respective places. First, I would like to tell the parents of sickle cell warriors, I am a sickle cell warrior and I'm 47 years old, so there is treatment. This morning, as a person with sickle cell disease, I understand firsthand the challenges and the pain associated with the condition. It is crucial for healthcare providers to stay abreast to the latest advancements in the insights in managing sickle cell disease. Supporting HB 349 in Florida ensures that physicians will receive additional education through the Department of Health, fostering greater awareness and improvements in cares for individuals like me. I'm nervous now that I heard her, but I recently had surgery, and as a sickle cell patient, you have several of them, unbeknownst to you, because it can happen at any given moment. And before the anesthesiologist was about to knock me out, they had to verify that I had sickle cell. And I was like, are you kidding me right now? You are the person for putting me to sleep and the person for waking me up, and you're actually debating what I have. So this is a very huge, huge issue in the health community. Not only are you challenged whether you have the trait or do you have the disease, you're also challenged with the needs in which are, for lack of a better word, accustomed to you, because everyone with sickle cell deals with this differently. It took all I could do just to get up. I could only make it here at 11. I missed the 9 o'clock stuff because of the pain. And you have to wait till that medicine kicks in, just being brutally honest. But I've been an educator for over 24 years, a college professor, as well as a climate and culture specialist in Hillsborough, and Valdez is one of my representatives. So I am so grateful that you're bringing this to the forefront, and it is imperative that everyone take notice, because we have a major increase of mixed babies, and we have more babies being diagnosed with sickle cell than just African Americans. Just saying.
Thank you. Thank you for your testimony. Ashley Bradley, representing herself, wishes to waive and support. Members, we are done with public testimony, and we are now on debate. Representative Hunchowski in debate.
Thank you, Madam Chair. And Representative Robinson, I just want to commend you on the work you've done to get this bill in the place to be here today. Without information, without education, you are limiting access to care. So this bill will make such a positive difference for so many people, including raising awareness about sickle cell disease. So I just want to thank you very much for this. And once again, thank Chair Salzman for putting this on the agenda.
Thank you. Next up, we have Representative Redmond. You're recognized.
Thank you, Madam Chair. Rep. Robinson, thank you for taking the time to talk to me last evening, because as you know, as being a physician, one thing that we're not really big fans of is mandatory CME. You know, we have 40 hours that we have to do. Matter of fact, I had to do mine recently. It expired January 31st. So it's a lot of hours. A lot of those things are already kind of mandatory in terms of what we have to do. There's controlled substance prescribing that's required, prevention of medical errors. There's domestic violence, there's HIV. And so we're never really fans of lengthening that list. I will be voting up, though, for this good bill. And I wanted you to know it's because of your efforts in terms of talking to us and understanding kind of where we're coming from. I just wish there was some way to target this information. You know, when we talk about relicensure, we're making people like plastic surgeons take this course, which to me might be a little unnecessary. The poor lady who gave testimony earlier, I wish there was some way to target that physician, because that's the physician who really needed the education. But thanks to your efforts, I'm happy to vote up for you.
Fantastic. Representative Skidmore, you're recognized.
Thank you, Madam Chair. And representing physicians as a nonprofit for the Palm Beach County Medical Society, I want to say I am looking forward to letting them know that this is a CME that they should and will take. I think that Rep. Ponchovsky said it does limit access if physicians are not familiar. My own disease was hard to diagnose when I was a child. I also understand what chronic pain and loss of vision is. So this is very personal, both on a professional and a personal healthcare level. So members, this is an incredible bill that it's wrapped in what seems innocuous as just a continuing medical education, but it will absolutely save a life and help a physician to provide the appropriate, proper, and holistic care that a person with this disease needs. And I have learned so much more about sickle cell in the last 2 years here in the legislature because of efforts like yours. And I'm proud to have an appropriation for sickle cell as well. So thank you so much for your leadership on this issue. And we still have a lot to learn, but with this bill, we're on our way.
Thank you. And I believe last in debate will be Representative Tant to close us out.
Thank you, Madam Chair. Representative Robinson, thank you for bringing this bill. Years ago, when I was a new mom and I was serving on a board and my son had been open heart surgery, and we were dealing with all the things, and I found myself in the role of so many of your warriors here educating physicians about what was going on with him. I spoke with another mom. She was the mom of a son with sickle cell, and I thought I had a load. He had been hospitalized 1 month 17 times. And so I started to learn about sickle cell then, and I'm so grateful for what you're doing now. We're all going to benefit as a society as we learn together, as well as our medical community. I'm really grateful you're bringing this bill. Thank you.
Thank you. And I'll just wrap it up by saying, what a great advocate. I loved how you marketed and how you kept coming to me and made sure that we got this bill on agenda. So I was really excited to send it up, and I'm glad to see that it made it today. And with that, you're recognized to close.
Well, thank you, Chair, and thank you for all of you. I just want to let you know that this bill has come truly from that community and the doctors. So you have a group of doctors that specialize with taking care of sickle cell patients. Where the issue comes in is when they are in crisis and they are in pain right then, and they have to go, say, to the emergency room or to a doctor, and they're unfamiliar with what's going on. And so we have been trying to figure out a way to address it. And as me being an educator, because I'm not a doctor, not in that field, but being an educator, I recognize that when people know better, they do better. And so we're hoping that with this additional education across the board, they'll all be able to help take care of our Floridians. So thank you for hearing this bill, and I hope that all of you all will vote up.
Thank you. Having closed on our bill, Sabrina, please call the roll.
Chair Salzman.
Yes.
Representatives Burfield.
Yes.
Bartleman.
Yes.
Abbott.
Yes.
Anderson. Baker.
Yes.
Bell. Black. Patana.
Yes.
Cheney.
Yes.
Franklin.
Yes.
Kamchowski.
Yes.
Persons Mullica. Renanda.
Yes.
Rudman.
Yes.
Skidmore.
Yes.
Snyder.
Yes.
Tant.
Yes.
Trabuzzi.
Yes.
15 yeas, 0 nays, Madam Chair.
Show that bill reported unanimously. Fantastic. Next up, we have Representative Amos